For those I have not yet met, I am Ruth Katz, Director of Aspen Ideas Health and Executive Director of the Aspen Institute's Health, Medicine, and Society program. It's really great to see all of you here this morning, including those of you who are just joining us for Fest 1, which begins later this afternoon. For those of you who have been with us for Aspen Ideas Health, I hope you would agree what an incredible time we have had together over these past few days. Early morning walks and evening conversations about the healing properties of art and the therapeutic potential of psychedelics, revelations about the digital future, and a look at astonishing medical breakthroughs, a deeper understanding of the importance of animals in our lives, and perhaps why we may need robots too. And of course, the incredibly very special session on the implications of the Supreme Court's decision to overturn Roe versus Wade, keeping Aspen Ideas Health absolutely up to the minute on breaking news and issues. Our team did an incredible job of putting that together. We also heard some extraordinary stories about a grocery store that doubles as a community sanctuary, the intuition of a mother, teens who are literally changing the world, and barbers talking to their clients about colon cancer screening, and the personal remembrances from those who knew global health champion Paul Farmer touched us deeply. I'm sure that all of us have our favorite session, the one that sparked that aha moment or tapped into the deepest emotions of empathy and hope. I know a lot of lessons have been learned, and I noticed, and it's absolutely true, there were tears that were shed. But as this event draws near to its close, I think what has really stood out is the sense of community that Aspen Health Ideas engenders. Whatever health-related role you play as a consumer, as an advocate, provider, entrepreneur, researcher, or public official, you are part of the ecosystem that offers an opportunity to drive better health for all. This year, perhaps more than ever, that sense of connection was palpable. We felt it in the many questions asked of our speakers, the engaging conversations that followed every single session, the enthusiasm of our fellows, and of course, in the many ideas, big and small, that kept emerging. We were continually reminded that together we can accomplish so much more than any one of us can accomplish alone. We truly are a community. I know you will be returning home with a rekindled sense of possibility, and I urge you to turn some of the compelling insights you have gained here into action that drives change. That is part of what Aspen Ideas Health is all about. Now, of course, it takes an enormous amount of energy and dedication to pull off an event like this one, which takes almost 1 year to develop, especially in the midst of a pandemic. And many thanks are due, and please bear with me, there are many. First, to our small but mighty Aspen Ideas Health team, Natalie Johnson, whom you've met before, Katie Taylor, Deb Cunningham, Jamie Davidow, Kathleen Shea, and Karen Fiden. You guys are simply the best, and it's the only group I'm going to ask to stand up. Where are you? A special shout out as well to the Health Medicine Society staff, Katya Wanzer and Raven Tucker. Dan Porterfield, our president and CEO, has been immensely supportive of Aspen Ideas Health, and Elliot Gerson, executive vice president for policy and public programs and international partners, has championed our work from day one, which is now 9 years ago. Thanks too to the Institute's communications team, particularly John Purvis and Ben Berliner. It is always a great privilege to open the 10-day Aspen Ideas Festival, and we are grateful for the help of those who make the festival possible, especially Kitty Boone, Killeen Bretman, Deborah Murphy, and Deborah's incomparable conference services team. Thank you also to the leaders of several sister programs within the Aspen Institute. Special recognition to Lola Adedokin Executive Director of the Aspen Global Innovators Group, and Jonathan Price, who directs our International Partners Program, which includes Aspen Institute, Ukraine. That the program went smoothly is in good measure to Richard Stetner and the Aspen Meadows team, most especially the remarkable, the truly remarkable Rachel Butler. NBC Universal proved to be a terrific media partner, and we look forward to a continuing collaboration with them. We are very appreciative of the video and audio expertise provided by Six Productions, of Libby Franklin's editorial assistance, and Erica Van Bachtel's tremendous communications-related support. And of course, the generosity of our underwriters makes all the difference. I think they really get the value of Aspen Ideas Health, and their contributions in so many ways are just essential. A special thank you to each and every one of them. Huge gratitude is also due to our terrific speakers and moderators. Many of them traveled long distances to be with us, and all of them sparked scintillating exchanges. My only regret, and this is my regret every single year, that each session couldn't have lasted longer. Thanks as well to our dozens and dozens of volunteers who were always on hand to greet us warmly, answer questions, and lend a helping hand wherever it was needed. I told you it was a long list, but finally, and most importantly, a salute to all of you for your attention and enthusiasm. You are the reason we work so very hard all year long to put this program together. We wouldn't be here if you didn't remind us how meaningful Aspen Ideas Health is to you. And again, thank you so much for being here. And now, to close out Aspen Ideas Health 2022, 3 terrific conversations. First, U.S. Health and Human Services Secretary Xavier Barcell. It's been a long 3 days, guys. My apologies, Mr. Secretary. He will be interviewed by Kate Snow. Kate is the anchor of NBC Nightly News Sunday, a senior national correspondent for NBC News, and recipient of multiple Emmy Awards. Pavlo Kovtoniuk, I've been practicing my Ukrainian, former Ukrainian Deputy Health Minister and co-founder of the Ukrainian Healthcare Center, will be interviewed by Elizabeth Cohen. Elizabeth is the award-winning senior medical correspondent at CNN and author of the popular CNN.com column, The Empowered Patient. Finally, Deepika Chopra, widely known as the Optimism Doctor, will be interviewed by Nick St. Fleur. Nick is a general assignment reporter at STAT and a former Knight Wallace reporting fellow who covers the intersection of race medicine and the life sciences. They will be coming up one right after another. There won't be an interruption among them. Before I turn the Aspen stage over to Kate, let me just take a moment to thank you all. Once again, you have a lot of choices of where you can spend your June. You have chosen to spend part of it with us. We are deeply grateful. Please travel home safely, be well, and I promise you we'll see you all back here for Aspen Ideas Health 2023. Kate? Thank
you so much. Thank you so much. Hello, everyone. Good morning. Good morning. Oh, this has been such an amazing, how many days now? Mr. Secretary, thank you so much for being with us and making time in an incredibly busy time. I don't know if you've noticed, there's some things in the news. A few that the Secretary has been having to deal with. I do need to start with the Supreme Court's decision. You were in Missouri. You were at one of the last, I think the last clinic that performs abortions in the state.
Right.
When the decision came down.
I was scheduled to be there. It had been an activity we'd scheduled because we're going around the country talking to people about what might happen. Yesterday morning, we were at the Planned Parenthood site in St. Louis. At the time, we were talking about what women should be preparing for. And by the time we had finished that conversation, the word was out that the decision was in. Right afterwards, they told me that they were already answering phones telling people they could no longer take appointments. Fortunately, they were smart. They helped establish a site just across the state line in Illinois, and now they are referring women to that site in Illinois.
So that's already happening.
It's already happened.
You know, people don't normally ask a secretary how you felt, but I really would like to know. I mean, you were expecting this, and yet I'm sure it took the wind out of you.
Well, I say this knowing that my high-risk OBGYN wife for several decades, who deals with this every day, has given me the real-life way of looking at this, that to me the biggest heartbreak is having a Supreme Court that we can no longer trust. That, to me, I think this last week tells you where the Supreme Court is taking us. They have said to states, you can regulate a woman's body, but you not so much guns and assault weapons, and not so much religion in schools. And so if that's the direction the Supreme Court, which is supposed to be a non-political body, is taking this country, our democracy's in real trouble.
Yesterday, President Biden called it a sad day for the court and the country, and he said, quote, "The health and life of women in this nation are now at risk." What are you doing concretely in response to the court's decision to try to help women?
Well, we're working with centers like Planned Parenthood, so we are restoring funding for Title X, family planning services. We are working with supporters on the ground to make sure that we are providing services to women where we can. We are looking into everything, including assisting in transportation, something that HHS doesn't typically do.
Can you do that legally?
Talk to me later.
I mean, that's a big question, right?
I always tell my team at HHS, if you've done your homework, then we have no right to do mild. And so we're going to be aggressive and go all the way. And I would tell you if you're recording, so I won't tell you. So,
this is all on the record,
yeah.
Mr. Secretary.
We are looking at every option, and among those is transportation.
Say that again?
We are looking at every option, and among those is transportation.
Transporting women to other states. What about the so-called abortion pill, which is FDA approved? The president said that you're making efforts to try to make sure women can get that even in states where abortion will now be illegal.
Medication abortion is available. It's been around for a couple of decades. Contraception was not overturned by the Supreme Court, so birth control is still available. We are doing everything we must, including providing guidance and information, not just to patients, but also to providers, because there are laws, and not just patients have rights to have those laws enforced properly, but providers have to make sure that they are administering services according to the law. And if a woman is entitled to services, we'll make sure that we enforce the law that requires that.
As we sit here now, can women order that kind of pill online wherever they are?
As of today, they can.
The Attorney General of Texas said that he's going to make yesterday a holiday to celebrate what happened. Former President Trump called it, quote, "the biggest win for life in a generation." This country is divided. How do you, in the government, try to bridge that now?
Actually, I don't think it's as divided as they make you believe, because the vast majority of Americans believe that women should have an opportunity to decide what's best for their health. We may start to see some gap in terms of what happens by the time you're in the third trimester of pregnancy, but there's very little doubt that the vast majority of Americans believe a woman should be able to make a decision early on during a pregnancy. And so, as much as some people would like to have you believe that we are totally split, we're really not. And it's just a matter of making sure we're as aggressive as the other side has been to make sure that we're protecting women's right to have the health care that they need.
But politically, we're pretty split. I mean, my inbox yesterday, all due respect, was filled with statement after statement, and they were diametrically opposite, depending on if it was a Republican or a Democrat.
I took off that hat a while ago being a politician. I now get to work for folks like Dr. Collins, former director of NIH, great people like Dr. Walensky, Dr. Califf, who both were here, and Chiquita Brooks-LaSure, who's the administrator at CMS you had here. Essentially, this is Aspen Festival of Health is the Aspen HHS Festival of Health. Because you have all these tremendously talented people who are, by the way, bargain basement price, we get their talent serving the entire public. But those are the folks I turn to when it comes to things like women's health, not politicians.
Yeah.
There's no reason why a politician should tell me whether I need to have a heart surgery or whether I have to mend my broken knee. there's no reason why a politician should tell a woman the same thing about her body.
There's so much news. I don't know if everyone in this room even knows that this morning the president signed a major new piece of gun legislation. The biggest change that's happened in this country in decades. And it would have been the big news if not for yesterday, I think, as far as the news cycle goes. Tell me about, there's money in the new gun law for mental health and for other federal measures that you're going to be in charge of. What happens?
And actually think about it, if you look at that bill that now is becoming law, we probably have the largest equities in that new law than anyone else at HHS, because so much of the focus is on behavioral health. So we're going to be really at the tip of the spear trying to help implement a lot of that with our local and state partners on mental health and behavioral health. We, again, put it in perspective. If we were sitting right now in the state of California, with this new law, we'd still be doing far less than the state of California already requires when it comes to gun safety. So it's great. I was in Congress back in 1993, 94, when we passed the assault weapon ban. We can't do what we did 3 decades ago, which is unfortunate, but I'll take it. We made progress. Let's bank that, and let's keep going. As I said, never do mild. This was a good victory. We ain't stopping.
There are a lot of advocates who were disappointed it didn't go further. Just concretely, what will that money do that you disseminate out to local partners? Do you know?
There'll be a lot more resources available, a lot more than there are now, which are woefully inadequate for what we need. So still not enough, but a lot more resources, especially to help young people. We'll be able to do much more behavioral health work in our schools. Remember the days when there used to be a nurse in the school? Well, that's basic. We don't have hardly anything like that. And now with all these behavioral health issues that are popping up, and by the way, the pandemic has made everything incrementally worse, especially for young people. Suicide rates, suicide ideation by adolescents are just dramatically higher. More than 100,000 people died from drug overdose. We're seeing, in last year, we're seeing just the tremendous stress. This will help. We still have to do more. President Biden in his budget actually is doing more than what this particular gun legislation is doing, where he essentially had us act in a game-changing way where we're investing over $50 billion over the next 10 years in mental health, because we're trying to give mental health the parity that it should have to physical health. And $50 billion goes a ways. It won't get us there, but it's the kind of commitment we've never seen from any president in the United States.
And the other thing that's in this legislation is allowing states to pass so-called red flag laws,
Yes.
allowing people to try to stop someone who has a mental illness from obtaining weapons.
Yes.
Do you said in California it won't really change anything,
No
but in
brainer.
other states
Yep.
it could.
Yeah, California's had its red flag laws for a while. They're no-brainers. You got somebody who's got a history of domestic violence, who's had restraining orders put on him, and is also a weapon holder. One and one usually equal 2, and in this case, 2 can be deadly. And so several states have acted. We finally now have a law that lets us move forward with these red flag laws in many ways. Again, it's good. It's not going to be enough, and we know what works that we can do that's more, because there are states like California, New York that have done them. But California just had its concealed carry law taken down by the Supreme Court.
New York.
I'm sorry, yeah, New York. New York did, and it's a travesty, as I said. It's free reign when it comes to weapons, but not when you're talking about a woman's body. Or if you're transgender, be careful with this Supreme Court.
I want to stick on mental health and substance use just for a second, since we were just on that subject. I have so many things I want to ask you about, but we had 2 panels yesterday that I moderated. One was youth mental health, and a lot of discussion about the lack of a system and lack of access to mental health care. And then separately, a panel right here where we talked about substance abuse. And how many, I think 88% of people who are struggling with substance use disorder do not get help. So my question to you, as the guy in charge of the systems, what can we be doing? What can this room help you do to make that better?
And I'm glad you ended by asking what people can do, because, well, it may look like we're in charge. Health is really a state function under the U.S. Constitution. We help because we supplement, but we can't drive what states will do when it comes to health care. That's their prerogative. But what we can do is give you some money to incent you to do certain things. So mental health, one of the things that we're doing is we are launching in less than a month a 3-digit phone number, 988, for anyone who is going through crisis. Rather than have to dial a 10-digit number in a particular state, which is different than it is in another state, if you really are looking for some help, if you're willing to turn for help before you go in the wrong direction, then we want you to be able to answer and get somebody who's a professional who can help you. July 16th, we launched 988, the Suicide Prevention Lifeline, to help people. We're also including text messaging there because so many young people use text messaging. And so what our goal is to make sure we can weave together all these states that have disparate programs so that we can have a functional 988, similar to what you expect on 911. Problem is, it's 50 separate parts. We don't own it, but we're trying to bring it together like the glue.
So just on that, I just did a story on NBC
did.
Nightly News about 988, and we went to South Carolina, and we went to the only center, the only call center that exists in South Carolina. And in the room were all these workstations and empty desks because they can't afford to hire anyone because the state has not passed any legislation. You know where I'm going.
Yes.
But for the room,
Keep going.
a lot of states haven't passed laws that would actually support the money that's needed for 988. What do you do about that?
Colorado, by the way, did. Colorado passed a law, so it will have a independent funding stream to support 988, and that's what you got to do. President Biden gave us close to $300 million to really help launch 988. Not enough, because you need to have it keep going. You can't just do it once. And there are states that are still behind. But we're working with them to get them going. We're setting up backup call centers so that if a state doesn't have the ability to answer a particular call, you know, the worst thing you can do is say, I'm going to reach out before I go the other way, and you get a busy signal or you're put on hold. And
or you get transferred to other states, which is what I was told will happen.
Well, we won't have any choice if we want to have actual pickup of the phone. And we're not going to let people just hang. So we're setting up call centers. We're trying to get every state to the point where they don't need to rely on some other call center in some other state to get there. Colorado did the right thing. California has done the right thing. We need other states to join.
And I'm sorry, go ahead. I interrupted before you got to substance abuse. You were going to talk about that too.
We broke glass and we changed our strategy on drug addiction and overdose, because typically in the past we've treated drug addiction as something that should stigmatize you, as not just you're not the victim, but you are the perpetrator of your own problem.
It's your fault.
Yeah, it's your fault. And unfortunately, it's already probably traumatizing to go through it. If you are ready to make that call to 988 or actually ready to get some help, the last thing you need is for someone to point a finger at you and say, you know, your fault, about time. And so what we did is, rather than just have a prevention of drug addiction, treatment of drug addiction approach, we're also now inserting what we call harm reduction, which a lot of places in the country have already started, which is that rather than wait till they're about to commit suicide or OD, let's stop them, because they're doing their body a lot of harm in between. And if we can stop them from doing the harm, when they finally get on track, they'll be ready to get back into life in a lot better shape than if they have totally ruined their body and their brain. And so harm reduction becomes a major focus. That's why you see we're giving opportunities for fentanyl strips to be used at some of these sites. Before it was, oh, you got to keep your hands off a fentanyl strip.
Yeah, those are strips that people can use to test their drugs.
Yeah, a strip that lets you test the drug you're about to take, which you shouldn't be taking, but you're about to test it, because fentanyl is so pervasive now. Too many of these drugs, unknowingly, are laced with fentanyl, which is deadly. You could die, and that's what's happening. So we're now supporting centers that offer fentanyl strips to people who are about to use drugs illicitly, so they can at least know if they're about to inject something in them that could kill them. A lot of folks say, you're just promoting drug abuse. We're saving a life. And we'll talk about the other part later. Let's save a life and go from there. And now we're also going to do follow-up. We're not going to let someone say, hey, you went through treatment, good luck, you're on your own. No, we're going to follow them now. We're going to try to be there, support centers that want to provide follow-up services, so we don't let someone just dangle once they're out in the naked world trying to survive after getting themselves clean.
I feel like this is rapid fire. Can I go to COVID now?
Yeah, right ahead.
Sorry, I'm looking at the clock.
I know.
So COVID this week, shots, vaccines available for the smallest of children. Yeah. And parents, you heard, I'm sure, from a lot of parents concerned or worried or not sure. What do you say to parents who aren't sure what to do?
Talk to the best person who can give you the best advice. That's your pediatrician. Please don't talk to a politician. Talk to your pediatrician. Talk to your medical advisor. Talk to the people you consult with. If you don't have your own insurance and your own pediatrician, family clinics are all over the country, and they offer you services. Talk to people who understand, and then I trust if you do that, you're going to make the right decision for your child. We've put out several million vaccines around the country already. Parents are asking. There's going to be a slower uptake. Most parents will say, I'll wait till my child is ready for their pediatrician visit before I get them vaccinated.
And the summer visit before school, maybe?
Yeah, and that's not the best way to do it, but at least if they get their child vaccinated, look, the vaccine has proven itself effective, including for kids. We waited this long because we wanted to make sure for our tiniest, we had the right combination. So it's time.
Should schools be requiring it this fall?
Should what?
Should schools and preschools be requiring
Education is a state function, not a federal function. And so
what's your opinion?
My opinion is, if I had my kids going to school, I'd say, why aren't you offering them a chance to get vaccinated? But I'm not an educator, and I am not a school district board member, but it seems to me that the quickest and fastest way to protect your child, and by the way, protect your child, to protect their grandparents and other relatives, the immunocompromised family member, is to get your child vaccinated where it's most easy. I suspect most people who are here watching this, it's not an issue. But go to parts of Alabama, go to parts of Central California, where families don't have a lot of money and a lot of options. It is a big issue there. If your kid can't get vaccinated at school, you don't have health insurance, you probably aren't getting your child vaccinated right away. That is not a reason why we shouldn't help protect people from a deadly virus.
The FDA is pulling Juul vaping products off the shelf. I know you're supportive of this. Is that enough? Or will kids, I have 2 teenagers, will they find another way? And will another brand pop up?
Well, kids are kids. Of course they're going to find another way. But we're doing is what's right. By the way, it's not just Juul. It's the vaping industry, which was marketing to young people a product that is addictive with nicotine. So we're not just tackling vaping, we're tackling tobacco. We're going at nicotine. And to me, this is one of our proudest, I won't say it's an achievement yet because we haven't passed through all the court fights, but we're now pushing to take menthol cigarettes off of the market. We're now pushing to take all the flavored tobacco cigarettes and cigarrillos off the market. We have now a proposal that's in the works to reduce the level of nicotine to trace amounts so that it's not so addictive when you smoke tobacco, which we think will cause most people, especially young people first starting, to not want to smoke because there's no pleasure in smoking tobacco and putting in your lungs if it doesn't taste good or if it doesn't give you a high. And now we're going after the vaping industry, which was going around the rules and marketing principally to young people. So on tobacco, we're not doing mild.
You know what?
We're not doing mild. We're going. As I said, never do mild, and we're not doing mild.
What about the argument that some of these electronic cigarettes replace cigarettes, right? Replace the real cigarettes with the tar and the nicotine, and so they're better for adults?
Let the evidence show it. FDA has to move forward, and it's there to regulate, and it can only regulate based on health and safety. If there's no health or safety reason to have a particular product, then it should be on the market. If there is a health or safety reason, if you can prove that this helps keep people safe from using cigarettes and it helps promote health of those who aren't smoking cigarettes, show that evidence, FDA must consider it.
Mr. Secretary, you have taken some criticism. I'm going to ask this as nicely as possible, but there might be people in this room who were among your critics. There were people who said in the health community, you have no frontline healthcare experience. You shouldn't be in this job. There was an article in the Washington Post in January that said the White House was worried about your approach on COVID. Are you secure in your job right now? and what do you say to those critics?
We have gotten 260 million Americans fully vaccinated. There are some close to 600 million shots of the vaccine have been administered in the country, vaccination, boosters. We are now working on helping address long COVID for people who are suffering effects after their first incident in illness. 988, we're dealing with undocumented migrant children at the border. There is not a child that you hear about today, as you were a few years ago, that were dying in the custody of the federal government. We are treating children with dignity, even though we don't know what their final outcome will be in this country once they go through the asylum process. But we're treating them with dignity and giving them the health and safety that you would expect to give to any child. That's not in the news anymore. We're in charge of that. We are taking care of behavioral health issues. We are launching a major effort on maternal health to try to address the disparities that occur in America, where there are some women who don't have good access to prenatal care and postnatal care and are actually dying or having their child die. That's happening a lot in the African American and Native American community. We are going gangbusters in funding that. I don't think any of that requires me to have an MD. And if I need it, I have my wife who's had one for three decades, so she's a great consultant. But as I said, I've got a team, Dr. Walensky, Dr. Caleb, Dr. Collins. You've got some of the best medical minds that are there for you. What you need is someone who can manage the second largest department in the U.S. federal government with a budget of $1.8 trillion, who can navigate Congress to continue to get more money, who understands how to deal with the courts when it comes to protecting women's reproductive rights, who will make sure that we work with the states, having been a state AG, to make sure that on 988, or whether it's behavioral health, or whether it's drug addiction services, that we are getting the response from our local partners as we should. You can get a doctor. In fact, you've had doctors serve as HHS secretaries. Tell me how that went, and then we'll talk a little bit more. I've had to answer that a few times. So.
I'm sure you have. We have like a minute and a half left, and I want to end on a hopeful note. What are you most proud of that you've been able to do or see in this job?
My mother would always remind me, mejor prevenir que remediar. Better to prevent than to remediate. We're doing a lot of prevent so we don't have to remediate. Frederick Douglass, a great American leader 150 years ago, said it just as well. He said, better to build strong children than to repair broken men. We're going to build strong children at HHS. And as I said, we're not going to do it mildly. We're going to go all the way. And so I'm probably most proud that we have helped essentially close a lot of gaps. Vaccines, when I came in, the vaccination rate for white American adults was close to two-thirds of them having had at least the first shot. This was early on last year, May or so. Black and Latinos, barely over 50%. Today, first shot, adult Americans, over 90% for white Americans, over 90% for Black Americans, over 90% for Latinos, over 90% for Asian Americans, over 90% for Indian Americans. We are going to make sure we close gaps. Today, there are more people who have insurance coverage to go access a doctor or a hospital than ever in the history of our country. That's because we went gangbusters in making sure the Affordable Care Act increased the number of people who got insurance. And today, Medicaid covers an additional 10 to 15 million Americans as a result of the pandemic. More Americans today have coverage than ever before. As I said, we're closing gaps. To me, I think I can be proud that every night that my mom prays the rosary, she can say with some authority to the man upstairs, the woman upstairs, my son's trying to do his part to prevenir y no remediar. So,
Secretary Javier Becerra, mucho gusto. Thank you so much.
Gracias. Thank you. Thanks, Kate.
I'm going to talk very fast because we have to get moving, even before he sits down. But thank you, Mr. Secretary Kate. That was a tremendous session. Thank you so much. Pavlo, you arrived from the Ukraine to here just a few days ago.
Yeah.
You took a bus to the border with Poland, walked across the border, and then you're going back to the Ukraine tomorrow.
Yeah.
Can you tell us all, we've all read about it, but you've been there the whole time. Can you tell us what is the situation there?
Well, you know, Elizabeth, I made all my way here to talk about one thing. And the thing is that some really evil things are happening in the world. And that is that health is not being a victim to war, which is happening in my country, but health is also being the weapon to war. And this is what I observe with my own eyes. And this is what I want to tell you about today. If you give me a couple of minutes, I will tell the story about that. Actually, I have never imagined that I will be talking about these things. By background, I'm a health economist. The most exciting part of my career was working in the Ministry of Health. I was a Deputy Minister of Health during the very historical times in the healthcare in my country. We were implementing the largest transformation in Europe in decades in healthcare sector. We implemented the single-payer universal healthcare in Ukraine in 2017, the thing which America is struggling to have, right, for many years. So we succeeded. And then it was in 2017, and the healthcare was growing, and it was a boom of development of the healthcare, and communities began to invest in health and to build nice clinics like this one on the screen, which I see here, but probably, yeah, that's it. That's an interesting place. I want to tell you a short story about this place. This is a primary care clinic near Kyiv, kind of 30 miles from Kyiv. The town is called Makariv. And that was built in 2018 as a part of this reform. The community invested their money. They built this place. This community didn't have the clinic before that, and there was a huge thing. And I visited this place as a Deputy Minister of Health when they built it. And there was a huge story. People celebrated to have it. Later, it became the mass vaccination center. And you can see this sign. It says, get your vaccine here. So that was the community vaccination center during the COVID pandemic. And that was great times. And then I left the ministry in 2019. And then I worked for World Health Organization for some time. And then I started my own NGO together with my colleagues, the Ukrainian Healthcare Center, to promote reforms. Further in country, we were working with communities like this in helping them to build their health infrastructure. But then the war began on February 24 this year, quite unexpectedly for many. I remember this day very well. I got up actually at 5 a.m. in the morning, hearing huge explosions, and then another explosion, and then another in Kyiv. And then next day, I just brought my family out of the city into safety. And most of my team at the center did the same. And then we started to look at what was happening, and as we started to see that as Russian troops were advancing, they were ruthlessly and brutally destroying the civilian infrastructure and livelihoods. It was not only a military thing. They had been destroying the civilian infrastructure, and they had been destroying healthcare. And I assembled a part of my team who were at the contact. Of course, it was remotely. They were all across Europe and Ukraine. I was in Ukraine. And we started to document those episodes of attacks on health facilities just intuitively. But very soon, that became our systemic work. And we figured out the really impressively massive scale of what was happening. In the first 100 days of war, there was 170 hospitals and primary care centers being bombed very severely. That is 1 or 2 every day. And within those 100 days, there was a period of 3 weeks, from March 1 to March 21, when the intensity of attacks was 4 to 5 hospitals every day. And then we understood one thing, that these attacks is not a coincidence. It's not that it is a collateral damage, the military are fighting, and of course there is some damage to civilian infrastructure. No. We understood that this is something bigger, and this is something more sinister. And we began to investigate, to deep down into that. And once Russian troops retreated from Kyiv, my family came back immediately to Kyiv. We decided that we need to be together with our city, to be at home, even though it was very difficult to be there at that time. And I began to deep dive into these hospital attacks, and I began to visit sites of those attacks. And on the news, I got to know that this clinic in Makariv was one of the clinics under attack. And I jumped in my car, and I drove onto the place. And this is what I saw there. And this sign was the only thing which remained. And I also made a clip, a short clip, which you guys maybe will be able to show you. At the place, there was just only a rubble over there, and the sign, vaccinate here. And I want to show you one more thing I brought with me from this place. This I found here among the rubble. This is a part of the shrapnel. This is a particle of the mortar shell with which the place was bombed. And you can see that this is quite a, if you want.
It's very heavy.
It's a heavy thing.
Very heavy.
And how it works. So when the bomb hits the place, dozens of these pieces, hundreds of pieces of this just flow in all directions with a huge force. And they just break everything to the ground. And even walls don't protect from this. This breaks the wall. You need 2 walls to be protected from these particles. And being at this place in Makariv, and there is again the photo, my team was able to investigate what happened. And we found out that it was attacked by the mortar fire. Do you know what the mortar is? I have to know, unfortunately. I also never knew about that before February. If guys, you can show it on the screen, please. The mortar is a kind of the tube like this, which stands on the ground at the angle. And then there is 3 to 4 people, soldiers, operating the mortar. And they have the shell like this, and they put it into the mortar and close the ears, and then poof. And then the other guy called the spotter, he looks at the target, whether the target is hit or not. And if it's not, he says, 1 step correction. And the guy at the mortar makes the adjustment, and the angle changes, and they make another shot, and another shell is being fired. And then it is 10-meter step forward. And then the spotter says again whether it was there or not, and then make another correction. And we could see on the screen, you can see the holes from this mortar shell. And we could see the direction. We could detect the angle of the attack. And we walked actually along the line of this attack, and we found another shell, another hole from the shell, and then another one, and then another one, and then another one. 4 holes outside the clinic. And then we walked 1 mile, which is the medium range of the mortar attack, 1 mile from the clinic, and we found actually the actual place from which it was fired. And we reconstructed the whole story, that those people did it on purpose. There were at least 4 of them. One of them was commander. He was making orders, fire, fire. The other one was spotter. He could very clearly see what was the target.
There were no mistakes.
Yes, he saw that that was a clinic, and there were 4 adjustments, you know, to target it finally. And then we began to investigate more and more, and we found out that in most of those 170 cases, that was either deliberate targeted attacks like this, or that they were indiscriminate attacks, but also without any care about what was there and hospitals there. And this is the story we are trying to tell the world now, that it's not a war. War is bad. Everybody feels bad about the war. But there is something more sinister happening, and that is turning our values, our value of human life, of healthcare being you know, the part of outside politics, outside war. These values are being turned against us and used as a weapon.
Talk about that a little bit more. Why the Russians, from your description of it, are making such an effort to target a clinic. Why would they do that?
First of all, it's not only clinics. It's every part of civilian infrastructure, which is there. For example, in Makariv, schools were being bombed. 2 water towers. They had water towers, 2 of them in the town. Every one of them was also destroyed by the targeted tank fire, just to deprive people of water in the city. And I am sure that you know all these atrocities in Bucha and Irpin, yeah, familiar names. But those are names of towns where the reporters were allowed on sites. There is about 10 to 12 places nearby, Makari one of them, which were very seriously destroyed. And in every of those towns, all civilian infrastructure was destroyed in order to inflict terror. You know what was the result? People were fleeing. People were being terrified, and they were fleeing. And I don't know if you know that, but Ukraine now has largest numbers of refugees and internally displaced people since World War II. 7 million fled the country. We have a population of 40 million. 7 of them fled the country, and another 7 moved internally, including me and my family, right? 14 million. 1 in 3 Ukrainians was forced to move out of his or her home. And I think that was not a coincidence again. I think that was a tactic. Why I think so? Because I saw that before it happened in Syria. The wars in Syria and Ukraine are very different, of course, right? Ukraine has a World War II style war of aggression. Syria was a civil war. But Russia intervened in Syrian war in 2015. And since 2015, there was 244 attacks on health facilities committed by Russian troops. Before that, America was already there fighting ISIS. You know that, right? So coalition forces, America and the European Union, had 4 cases of hospital attacks in a couple of years. 4 cases, all of them incidental. ISIS committed 10 hospital attacks. Russia committed 244 hospital attacks in Syria. What we had as a result? A huge refugee crisis, right? To Europe. But that was 1 million of people fleeing to European Union, creating the huge crisis in Europe. Now it was 7 million of those 5 million went to Europe, and 3 million went to only one country, Poland. And I think this is a tactic of war. I think this is weaponization of civilian infrastructure and of livelihoods.
You reached out to the World Health Organization about this.
Yes.
What was the response?
You know, in the very beginning, we were, of course, very hopeful that that would be the reaction, because the things were quite obvious. You know, the scale was unprecedented. And we hope for the reaction from the international community. And we look at WHO, you know, because it was quite a specific situation in the history of the WHO, because one member state would come to the other member state and begin to destroy the healthcare system. And WHO, by the way, has their own tracking system of hospital attacks. And it was clear to them. But what they did nothing. For 1 month, World Health Organization refrained to call Russia an aggressor. They even refrained to calling it a war. They used the words like crisis, tragedy is unfolding in Ukraine, you know.
As if there were no...
As if it was
no
a
one
natural
caused it.
disaster.
Right.
Yes,
Right.
absolutely. Only after approximately 1 month, they began to say that Russia should stop that, you know, and so on and so forth. But they never did anything serious. They had their regular World Health Assembly in May, 3 months after the war began. No emergency meeting, anything. Regular Health Assembly gathered, and they did what? They adopted the resolution with the words of being terribly sorry, and that's it, you know.
What could they have done?
They could have done something because they have the constitution, WHO like UN. They are kind of, WHO is a replica of the UN. It is the assembly of countries. It's like the parliament of countries in health, you know that, right? And they have the constitution saying that if some unexpected things like this happen, they can impose sanctions on member states, like suspending voting rights, like depriving them of privileges. For example, a Russian Minister of Health is a member of the executive committee of WHO. And they are okay with it, you know? He decides on the policy of WHO, or how the money flows, you know? And by the way, he will listen to the Director General of the WHO about the humanitarian response in Ukraine soon. So he will sit and listen. I imagine, like, you know, on Wednesday, for example, Russian Minister of Health is sitting in Russia at one table with the Minister of Defense, discussing how they destroy Ukraine. And on Saturday, he goes to the WHO, and they discuss how WHO helps Ukraine, you know? Crazy. But I think that the WHO is just, you know, helpless about that. They don't know what to do because this is quite new for them. And I wrote an email to my friend, the director of the European, how they call it, European Department, European Bureau for WHO. I wrote in the very beginning. I was very direct. He never responded. Maybe I was too direct. But yeah, yeah, that's it. WHO just pretending that they are apolitical, you know, they're just bringing drugs to Ukraine, which they do. Thanks for that. But as a political body, they do nothing.
So your reach out to the WHO was an email. Did you ever get a response?
No. No, I haven't.
What you're describing are war crimes. Can you talk about, actually, let's go back in time a bit to Bosnia, to the 90s.
Yeah.
How long did it take to prosecute those war crimes?
Yeah, that's a good question. Because the part of our work now is that we are documenting, 2 people from my team do a full-time job of documenting war crimes for international criminal courts. But this is not enough for us because we knew the example of Bosnia, when it took up to 20 years to get people accountable. They were held accountable. That's a good news. But it took almost 20 years, you know. That's too long. So we chose another strategy. And we, okay, in parallel, we do all those litigation work. But what we do most is we are trying to reach audiences like you. And we are trying to work with investigative journalists, with the media, just to build this case that, guys, something that, the evil is growing, the winter is coming. Look up. And we need to stop that, because this is a very serious attack, not on infrastructure. This is attack on our values, on our shared values, and on our ways of life, and on what we respect, on what we believe. And this is intentional, because if you are attacking a country, right, knowing that the human life is what is valued there, and the human suffering is what you want to diminish in your country. So what you would do? You would inflict as much suffering as you can to exert the pressure on the government of this country and to make it surrender. So you make pain to this country, and this is a red line, I think, right? This is a red line, and this is exactly what Russia was doing in Syria, in Georgia, in Chechnya. Nobody did nothing, and I don't want that the world will do nothing again,
So you're gathering this evidence.
Yes.
So that 20 years from now, you'll be able to present it.
We will present it next week.
Okay.
Yes. Yeah, we are finishing the report, and we are going to present it, not waiting for the legal system, which is very slow.
You're presenting it to whom next week?
To the public.
Okay. So, but as far as presenting it to the actual court that deals with this, are you sort of, it sounds like you're trying to do two things. You're doing something more quickly, more soon.
Yes.
For the public, for the world, but you're also gathering evidence for what could happen years from now.
Yes.
But you're taking
We do
both
both.
tactics.
We use all the means, all the instruments we have, and I do believe in the international justice system, but first it's long, and second it's political, and it is very important that Russia and Putin regime, they don't win this war, even at the smallest part. Why? Because then it will be very difficult to bring him to the accountability and to justice, Because in Bosnia, Serbia then, a perpetrator, they lost the war. And this is why Milosevic and all these war criminals were brought to the court. If Putin wins the war, they will never be brought to the court, Nobody can take them. So what we need your help of your government, of your public opinion to win this war. We will be fighting to the end, but we need your support. We need to fight together with you, because we are fighting for the cause which is common to us,
Aid has been given by the United States and by others. What more? You've got a secretary right here. You've got other dignitaries in the audience. Is it just more of the same or something different that's needed?
I am a health person, right? And I should be apolitical, but I would ask for weapons. More weapons. Now it's only about military things. Now military are speaking, When they do their job, when we will win, when we will throw them away, then health people will be speaking, and other people will be speaking. So please help us win.
You said something that surprised me a little bit. You said that you have, I think you used the word confidence in the international justice system, and you worked for WHO, so presumably you have some respect for that system. Neither one of those systems, it sounds like, has been helpful at all in the past, 4 or 5 months. Why do you have confidence in them?
Because I'm an idealist, and I believe in values which are proclaimed, and WHO proclaims good values. And the international system of peacekeeping which we had after World War II has a very good values at core, which I strongly believe in. And we must, use the infrastructure we have. And that has a part of the political leadership of this system, which feels very uncomfortable about being tough and about getting out of the comfort zone and do some tough things. But that's a problem of people, not of the values, you know? So I would say let's defend our values. Let's not make health being part of war, and let's fight for this justice. Help us to do that, you know? We will do that. We are holding on, and yeah, we are carrying on.
We've reached 0, but I want you to read your bracelet, and then we'll go.
Yeah, I need another minute, sorry. I have a bracelet here. It says, fuck you, Putin. Yeah. Back in 2014, the Minister of Health I worked with, her name is Ulana Suprun, and he is American-born. He came from America to Ukraine to help in a war against Russia in 2014 when it all started. And she was busy assembling the tactical medical kits for our soldiers. And when they had this tactical medical kit, they would put one bracelet like this into that medical kit. So many of our soldiers have these bracelets on their hands right now. And I have one with me. So that's the story.
Okay. Pavlo, thank you.
Thank you.
Can you hear me? Oh, I just wanted to say that was so incredibly powerful. I would actually love if we could give another round of applause to Pavlo. Thank you for being here, and thank you for sharing your message. So Dr. Chopra and I have the difficult, tough task of talking about optimism following what we've just heard about, you know, war crimes and then the repeal of Roe versus Wade. But I think something that would be particularly helpful to our discussion is to first turn it over to you all and ask, who in here considers themselves an optimist? I'd like to see a show of hands. Okay, this is actually a pretty optimistic group. I'm very happy about that. And when we talk about optimism, what are some words that come to mind? I'd love if you could shout out some words that come to mind when we say optimism. Hope. Positive. Obama? Okay. I heard hope.
Positive. Hope.
What was that? Love, hope, science, youth. Yes, our youth. Hope. Action, trust. Oh, this is a very optimistic group.
I know, I love that.
Dr. Chopra, tell us a bit about what
was it?
Gratitude. Yes, what optimism is to you, and then the words that come to mind when you think about optimism.
First of all, I'm so happy to be here. I woke up this morning, and I have to be honest about something. I am known as the Optimism Doctor, and first and foremost, I am not the most optimistic person. Putting it out there, I always like to share that. I am a human, and I am on the same journey as everyone, trying to increase my own optimism, and at times it can be really, really tough. I woke up this morning, and I turned to my husband, who is actually here in this audience, and he's never actually heard me speak in all the years that I've done this. But he's here with me, and I turned to him, and I said, I don't feel very optimistic. And I just had this really heavy feeling, and not in the mindset or the uplifted mindset I would have liked to be in addressing the topic of optimism. But as I stood there and I was getting ready, I all of a sudden started to think, and I thought, it is in this time, days like yesterday, days like when I woke up this morning, that we actually need to talk about optimism. We don't really need to talk about optimism when everything's going well. We need to talk about optimism when we're going through struggle. And that's when the tools count, that's when the resources count. And I think that really sort of made me think about the words that I think about when I think of optimism. And a lot of them are the words that you guys shared. Oftentimes when I speak to a large crowd, the words that get shouted out the most, and I heard it a couple times, but not as much as I usually do, which I actually was kind of happy about. This is a very truly optimistic crowd. I hear a lot of positivity. And I did hear that, and that is one of the words that definitely comes up, but for me it's about 4th, 5th, 6th on my list. The two words that come to the forefront of my mind in studying optimism, when I think about the notion of optimism, is resiliency and curiosity. And I think that surprises a lot of people, but I started to feel a lot more optimistic when I look at that lens of resiliency and curiosity after I heard the first two talks today in the closing session. And I needed that. I also felt a little more optimistic when I walked through this insanely gorgeous campus that's just inspiring just to be here, which I know we will talk about different ways to actually increase our optimism. But, you know, I always like to start, and it's a weird place to start, but I like to start when I define optimism with what optimism is not.
Yeah, debunk some optimism myths for us, please.
So optimism is not, and I thought about this because, you know, I know I was brought here to have the ending of this whole festival to leave everyone on an optimistic note. And when I woke up yesterday as I was here, that obviously felt extremely daunting. It was a big task. But optimism's not about having all the answers. Optimism is not about being the quickest to recite some blanket affirmation in the mirror 10 times. Optimism's not about being positive 24/7. Optimism is not about being devoid of reality. Optimism is not about turning off real life scenarios that are happening around us in our personal lives, globally. A true optimist is someone that is very intentionally aware and mindful of the roadblocks, the setbacks, the less than ideal situations that are going to happen in our everyday life. But the caveat is that they see these situations as temporary and something that they have the ability and power to overcome, even if they don't know when or how. And I heard a lot of that today, even with Mr. Secretary speaking. I needed to hear all those things. I obviously am in the mental health world, and I know it's grim out there right now. You know, one of the statistics that sort of shocks and awes me is that the average delay time between onset of a symptom of a mental illness or anything like that is 11 years before someone gets treatment. 11 years. And that's astonishing, but at the same time, what I know about some statistics in mental health recently, and especially after COVID, is that we are all talking about mental health a lot more. And one of the reasons that there is that 11-year, there's a lot of reasons why, and a lot of that's access, and thank you for 988, that's really going to help. But a lot of it is stigma. And just have people ask me all the time, what is one way that we can actually start to break down the stigma? I don't know if I can do it, I'm just this random person. Literally the most important way to break down mental health stigma is to talk about your mental health with your own networks and community. While you're eating dinner with your friends, talk about your mental health, ask about their mental health.
Who is that community to you?
To me, my community, my husband, my family. I come from an Indian background where mental health is not something that you actually talk about. You know, we see in a lot of different places that they may not have the same statistics we have, but a lot of times it's also because you don't talk about it.
Right.
And seeking help is for when things get really, really bad. Like, I mean, like really bad. But what we really should be doing here, and I think what I'm optimistic about, is preventative care. And I know we've talked about that as well. And I feel blessed that I do come from a family where even my grandparents, my grandpa's 95, and I talked to him about my mental health. I asked them about theirs, and I probably was putting it in their face a little too much, but I was trying to normalize it. I've been talking about this since I was 12, you know, bringing stuff to the dinner table.
Do you have any kind of stories to share with us, or any experiences that were, you know, dark, or that were tough, and how you were able to find optimism through that, or find resiliency through that.
Well, I mean, I'm telling you, this is a really tough time. As a woman, as a mother, this is a really tough time as a human in our country over the last, I'd say, a lot of years, but the last 5 years, things are very grim, and there's a lot of despair, there's a lot of inequity, there's a lot of rage. And what I would say, and I think another thing that maybe would be surprising, is that it's okay to be full of rage. In fact, we need you to be full of rage. You know, it is important that we understand that we are humans and we experience the full range of emotions, and we need to start normalizing that.
Right.
It's not about, like I said before, looking in the mirror and saying, things are gonna be great. Everything's lovely, I love myself. The world's wonderful. The world is wonderful. Optimism's not about or. Optimism's about and. It's about being able to sit in your experience, like right now, I can feel the rage and the terror. I'm scared of what's happening, but at the same time leave space for hope that things will change, and they always do, even if we don't know how. So it's this idea of living with the and.
There was a panel yesterday on Roe versus Wade that I'm sure many of you attended, and one of the optimistic notes we left with was that, you know, people are angry, people are ready for action, people are really, you know, ready to make change, and I think that really is a point of optimism during all of this. So, you know, you've been elaborating on this, but I'd love if you could speak a bit more. After everything that we've heard today, you know, the wars happening in Ukraine, you know, Roe versus Wade, and our country's mental health crisis, how do you keep yourself optimistic? Are there, whether it be like little things that help you just feel better or little things that help you get through the day? I mean, what are you doing now to get through the day?
So I think a huge piece of this that we don't really talk about a lot is timing. Yeah. You know, not all of us are ready at the same time to find a silver lining, and that's okay. I woke up this morning, I'm talking about optimism, and I'm not ready. I'm not ready to sort of flip that switch and say, like, everything's gonna be okay. But what I am ready is for that and. I'm ready, I know that what it means to be optimistic is to sit in my emotion and respect it and validate it and know that it's okay, and that I'm not getting out of it unless I'm in it and I go through it. There's no way out. I mean, you've heard that. There's no way out, but it's just through. I know this sounds kind of silly, but I'm a very visual person. I'm a visual imagery expert, and that's actually that's a whole nother topic, visualization. But I like to really visualize things, and I visualize emotions like kneading a piece of dough. You have to literally knead the piece of dough, your emotion, to go through it. You can't just pop it into the oven and expect it to turn into a pizza. You have to work on it to go through it, and it's uncomfortable. And so a lot of being optimistic is being uncomfortable, and it's about resiliency. And so for me, what helped me today, I have to be honest, is I came in one way, I walked through this campus, things started to shift for me. Research shows that spending just 2 hours on average outdoors, and I'm not even talking about exercise, just outdoors, 2 hours, that's not a lot, on average per week really increases positive emotions and decreases stress cortisol. And that works for me. I walked through here, I started to feel a little bit different. I started to be open to different ideas and different things. I didn't feel so stuck, but it doesn't change any of the reality. I sat down and I listened to the last 2 sessions, and I was able to gather and garner up a lot of hope, a lot of things are going to change. Things are already changing, things that I didn't even know were happening that I'm hopeful about in this country, while at the same time being, excuse my language, but fucking pissed about what's happening in this country. And those 2 things, the and is where optimism lies. I mean, and so, and then hearing, you know, Pavlo's really incredible story and resiliency, you know, it doesn't change the situation, but he's here. He got here after all that. He's telling us what he needs. That's really important. His resiliency is one of the largest forms of optimism. And I know this whole last few years, we've all gone through, or all of us in different ways, a collective level of trauma. And what I like to share, not to be too silver liney, because some of us aren't there yet, or we can be, but not totally. is that we also have gone through a collective level of growth and resiliency. I'm sure every single person in this audience in the last few years, whether it was because of the pandemic, whether it was because of a number of different things that we've talked about here, and I know we're focused on health, but I'm sure you guys have surpassed certain limits that you never knew you could surpass. And whether they feel small or big, you've changed, you've grown, your level of resiliency has increased. There's no going back from that, and that is something to be optimistic about.
Dr. Chopra, you brought up some examples of research in the field of optimism. This is a health conference, where most of us are very much science people. Can you kind of make for us the science or the evidence-based argument for the importance of optimism, for incorporating optimism and optimistic practices in our lives?
Yes, and I love this question right now because there was a really, really amazing, exciting piece of research that just came out of Harvard. I'm not sure if anyone saw it because I know there's been a lot going on, but for me, this was big news in the last couple weeks. So what we've always known about optimism is that not only is optimism, as we can imagine, good for our emotional health, optimism's actually very protective and good for our physical health as well. And so we've, through lots of research over time, we've really seen that the more optimistic you are, the longer life you live, and not just long, but enjoyable. So it actually increases our lifespan, longevity. We get sick less often. We bounce back from respiratory illnesses more. Our cardiovascular health is much better. We have greater sense of purpose. We have better relationships, which are all aspects that help us live longer. But in the last couple weeks, what we have seen, which is very exciting, most of this research, big surprise, or not big surprise, has really been done with the white population. And that's something that we can't ignore. And in the last couple of weeks out of Harvard, there was a really amazing, this has been going on, it's a very long study. It was mostly women and women from all different racial backgrounds and socioeconomic status. And what we found was the same thing even for that space, that 25% of the most optimistic people in the study are likely to live 10% longer than the 25% that were the least optimistic. And that's big, and they were to live longer beyond 90.
Right. So tell us, what does that mean, though, to be optimistic? Do I have to walk around all day and thinking to myself, like, I'm going to look at the bright side of this. I'm always going to look at everything, glass half full. What does that mean to be optimistic?
So it's that idea of living, like I said, with the and knowing that your situations are temporary, whether good or bad. To me, the thing with the study that came out, which was actually really interesting as well, is the more optimistic you are, the more likely you are to live a healthier lifestyle. And that makes sense because if you have some investment in your future self, you can see yourself in the future, which, by the way, a lot of us humans are not great at. We actually can't see past very near future. Our brains are doing so much that we just say, that's too far off. I can't really think about it. And that's where visual imagery comes in. A lot of work has been done now on the study of visual imagery and optimism. And if you can visualize your exact self years from now living a good life and filled with purpose and the things that you want out of it, you're more likely to make decisions today that are healthy and preventative to get you there. And so being optimistic is about being resilient. It's about looking through your life and seeing the struggles you've overcome and knowing and focusing on your strengths and the things that you're good at, and knowing and having a trust and confidence that you will get there, and being curious about where you're at and how you'll get there, because no one knows all the answers.
So how do we share that optimism with others? I mean, is that practicing, gratitude? Is that giving people, thank yous? How do you share your optimism?
So it's funny, I know gratitude has come up a lot, and it's actually, it's something that I think most people know about because there's been a lot of research done on gratitude, and it is, I won't spend too much time on it because I feel like most people here actually know the research behind gratitude, and it's amazing for ourselves emotionally but also physically, and it actually changes the way our brains fire, the neurons fire. But what I will focus on is another piece of research, because I like research too. In the last couple of years, that was very exciting to me. One of the greatest forms of sort of protective from anxiety that we can be, which is also something that's associated with optimism, is less anxiety and being able to sort of navigate through stress and anxiety better, is experiencing more levels of awe. And to me, this was one of the most, this research came out right before the pandemic sort of started. And to me, this was one of the most exciting and interesting I liked that there was something different that we were talking about other than just sort of gratitude or mindfulness, which is huge. But the more we practice and are in this sense of awe, and so when I say awe, I mean being transcended out of yourself into something bigger, something that inspires you. It could be a person, it could be a beautiful piece of music, it could be walking through the meadows here, because looking at the trees and the wind, I'm seeing so much right now that's actually bringing me awe. Looking at a piece of art, being with someone that deeply inspires you or listening to their story. I actually interviewed for my podcast this woman, Dr. Edith Eger. I'm not sure if anyone here knows her. She is one of the most phenomenal and optimistic humans I have ever encountered in all of my sort of research on this. She is a Holocaust survivor and is also a psychologist. And just listening to her voice brings me into awe. And sort of, it's not easy to listen to her stories. I mean, that's not it. But it is one of the most inspiring things and brings me sort of outside of myself. What we know about awe is, astronauts that go into space, that could be a very anxious thing. You're in a tiny little spaceship. It's not being at, the Jerome Hotel. It's claustrophobic. It's scary. They prep for this a lot. But what we found was there's this protective factor. It's seeing the things they see, and that awe of looking out into the vast space is actually protective. And I don't even know if I'm answering the question that you said.
Certainly are.
But there are a lot of things that we can do for ourselves on an everyday level. And what I really am passionate about and specialize in is not these far off sort of like, to get better and be more optimistic, you need to, go to this retreat and spend all this money or do this course. I mean, it's literally focusing on the strengths and resources that we have as humans inside, whether it's things like using our breath, whether it's taking a walk outside, whether it's perspective shifting or asking yourself certain questions or spending the time to figure out what your purpose is. Purpose is wildly protective.
What do you feel is your purpose then?
This is my purpose. Honestly, I have gone through, in a short period of time, a number of different careers. I started as an investment banker. I worked at a punk label, a punk music label. I worked in the healthcare space for a little bit, and I was never really it became a big joke in my family, sort of like, she's not that great at commitment. I am married to my husband for coming up on 7 years, and we've been dating for 11, and I foresee it. I visualize us being together for a very long time. We have 2 small boys, not that type of commitment. But I think partly it was that I hadn't found my purpose. And I think what's important to know is that our purpose changes. And there's a very ancient, so I love blending together evidence-based science with holistic practices. And from all different places, I teach a workshop on something called Ikigai. Has anyone heard of Ikigai? Yeah, it's a ancient Okinawan practice where you actually find your true calling and your sense of purpose. And it's sort of this exercise that you can go through, and I like to do it seasonally. Your purpose changes, your values change, and one thing we know, if you're flexible with your emotions, you live in the and, not the or, so we're not being rigid. You know your sense of purpose. These are all just these are the things I think are the most important. And you focus on your strengths and the things that you're good at, because as humans, what are we mostly sort of prone to do? We focus on what we need to improve on, the things that are not going so well. When we're at work as teams, we focus on what milestones did we not reach? How can we do better? How many of us today have already thought about what we're good at? Has anyone actually today thought about, I'm really good at this one thing?
Yeah, good. Good to hear.
One person, which is
it's
amazing.
Good to see at least someone.
I would urge everyone to think about something they're good at right now. I would urge everyone to some of these things sound kind of silly, but it's the silly little things that we're finding from an evidence-based perspective actually increases our quality of life, like joy.
Right.
Has anyone here thought about something that brings them joy today?
Yes.
And gone forth with it? So sounds kind of silly, but I woke up in the mood I told you about, and I bought cowboy boots yesterday.
Very
And
nice.
I thought about wearing them this morning, but I felt kind of silly.
So, Dr. Chopra, what do you then say to the critics of optimism, the, dare I say, pessimists?
Well, what I would say is, first of all, there are no such thing as optimists and pessimists. I think we all are on a continuum of optimism and pessimism, and we are naturally better at being optimistic about certain aspects of our life, and we're naturally more prone to be pessimistic. I know I will share for myself. I am wildly pessimistic about my own health and medical-related stuff, so you can imagine what it's like living with me through when the pandemic started. Don't ask my husband. And I know that's where my work lies, and I'm really optimistic naturally in some other aspects of my life. But it's an ongoing process, and it changes over time. When I had kids, I became more optimistic in some levels and super anxious and less optimistic in other aspects of my life, and it's this constant check-in. And so what I'd say is, the one thing that's so important to know is a lot of people come to me, and it's another myth, and say, but wasn't I just born optimistic or pessimistic? And don't I have to just thank my genetics or my parents or my grandparents for the reason why I am pessimistic or I'm optimistic? And yes, there is a genetic component. There's a lot of research done on this, and some varying, but the most that I've ever seen in research is about 25% of a heritability, and the rest of it can be learned, and it's a muscle.
So you've talked about the scientific benefits to being optimistic. I'd love if you could give the crowd just some take-home or tangible things, and you've already touched upon a number of them, but if you were to give us a few tangible things that this crowd can do as soon as they leave this tent, go back home from Aspen, that can help them be a bit more optimistic about the world and about themselves.
Go outside, get outside, whatever that is, 20 minutes a day if you can, be outside. I know that is different for depending on where you live or what your life looks like, but I mean seriously, just open your front door and sit on the sidewalk. I mean, obviously that, if you can move your body, excellent. What we find is that moving our body, not like extreme exercise, but just a small amount every day, body moving. Naturally, people that are happier and live healthier lives, they live in towns or cities where you have to walk a lot. You walk for something that you need to do, or they move more. And so I would say move your body, be outside, focus, I can't say it enough, but focus on your strengths and celebrate your small and large wins. That is such an important piece. Optimism is about accepting responsibility for when the things go well, and also not accepting too much responsibility when they don't go so well. So what we know about when we measure for optimism, one of the questions that I always ask is, when something negative happens, are you the type of person that sort of is like, well, I did that, it was because of me, and it's permanent, and it's always gonna be that way? Or are you someone that's sort of like, well, these are the different aspects of what happened. Some of them were outside of me, probably won't stay this way forever. And then when something good happens, are you someone that's able to accept responsibility and say, I did a really good job, I made that happen? It's actually kind of rare for people to be able to do that, and that's a hallmark of optimism.
And I know it's not Pavlov's bracelet, but I know you brought something up here as well. I'd love for us to take an option just to tell us a bit about the cards, and I'd love to leave our audience with just one thought from
yes. So this is the Things Are Looking Up Optimism deck of cards. It's actually interesting. It was born out of speaking to audiences like this and being asked, what are a few different tips or science-based things that we can do when we leave here that actually work on increasing resiliency, optimism, and more joy, hopefully, in our lives? And so here are 52 of them. And you just pick one.
I like this one.
Pick one.
Yeah, so this one says, and I think it's something that we could all think of. Just check your expectations. Are you expecting something positive or negative to happen? Now try and focus on the things you are positively expecting to occur. The optimism tip is we often get what we expect, not what we want. And I think that's certainly something that everyone here can kind of keep front of mind as we go forward, despite all of the things happening right now in the world.
Yes.
Dr. Chopra, thank you so much for your time, and thank you for sharing your optimism here. And thank you all so much for being here at the Aspen Festival.